Excellent. Well, I will hand it over to you, Peter.
Okay. Welcome, everybody, to the first meeting of the Committee on Global Health Coordination, Partnerships and Financing for Advancing Pandemic and Seasonal Influenza Vaccine Preparedness and Response. I'm Peter Sands. I have the privilege of being the chair of this committee alongside Devi Sridhar as co-chair. I'd also like to welcome and thank the Department of Health and Human Services Office of Global Affairs, Colin Weinberger. Great to have you with us. And also the International Committee co-chair, Prussian Yadav, great to have you with us. And I'm delighted to welcome, for the first time altogether, the members of this committee. I want to note, and I also welcome anybody who is streaming this session, that this is an open, on the record information gathering session. The committee is in the process of assembling inputs and materials to guide their deliberations, create findings, and on the course of developing recommendations. We should be mindful that at this stage, the committee is very far from having made any conclusions, and that anybody listening to the discussions should not take away any sense that we were at that stage. Comments made by individuals, including members of the committee, should not be taken as positions of the committee or of the academies. This is the first of 5 planned committee meetings. Some of these may include public sessions where we will have the opportunity to hear from experts in the field, and we will be listening to a lot of inputs and deliberating and discussing among the committee members before writing the draft report. Moreover, once the report is drafted, it will go through rigorous review by experts who are anonymous to the committee, and then the committee itself will respond to the inputs and review comments from these experts in a process that must adequately satisfy the Academies Report Review Committee and the chair from the National Research Council before it is considered as an NRC report. The expected report release date is September 2021. Further information on this study, including future meetings, can be found on the project website. The open session today is an opportunity for this committee, the Committee on Advancing Pandemic and Seasonal Influenza Vaccine Preparedness and Response, and the sponsor of the study, so both the International Committee represented by Prussian Yadav and the sponsor, the Department of Health and Human Services, represented by Colin Weinberger, to address the committee, describing the context and reasoning that went into the committee's statement of task. And after hearing from both the International Committee and the sponsor, we will be welcoming a speaker from the World Health Organization, Sylvie Briand, who will discuss the WHO's conceptualization and governance of influenza vaccination. During discussion sessions, the committee members' questions and comments will take priority. The public can submit questions to the study email address listed on the project website, and the meeting is being recorded. So with that, what I would like to do is introduce Dr. Prussian Yadav, co-chair of the International Committee and senior fellow at the Center for Global Development. Prashant, over to you.
Thank you, Peter, and thanks everyone for having me to just share a very brief overview of how the International Committee thinks about the overall body of work, and in particular, how this specific committee's work fits in within that overall framework. So I think this isn't new to any of you. The risks of novel influenza viruses remain extremely high, even though most of our attention focuses on COVID-19. I think there are 4 or 5 things that Martin Friede and I thought were important to highlight. The first is that This is not a new area. I think amongst the 4 committees that have been formed, financing, coordination, and partnerships is by far one of the most important, if not the most important areas of work. And I say that because if you look at the statements of tasks of the other committees, all of them to some degree rely on having sustainable financing, whether it's for manufacturing, distribution, R&D, non-vaccine public health measures. Also, they all depend upon a global structure for coordinating and on things such as regulatory architecture. So I think this committee in that sense is very important, and what you all come up with will help the International Committee put that in the larger context. The second is that this is not a new area. Coordination, financing, partnerships for pandemic preparedness, including for influenza, has been discussed quite a bit in the past. There have been bodies of work. So I think what we hope this particular committee will do is take all of that work into account and all of the new things that we've learned in COVID-19 and bring all of those together. So think of it as building on or advancing. We also think that the nature of the work of this committee is such that it requires multidisciplinary and cross-disciplinary approaches, whether it is economics, public health, game theory, mathematics, epidemiology, immunology. All of those things have to come together for this committee's work to be meaningful and impactful, and I think you all are cognizant. There are many members of the International Committee who are members of this particular committee. I think this is the one which has the most members from the International Committee. So in that sense, there is a stronger connect. Then the other thing Martin and I thought was important to highlight is that while the National Academies have a process for committee selection and a way of doing that, I also encourage you all to think about wherever this committee can hear more directly from experts who are based in many of the countries internationally which are impacted or need to be a part of a larger coalition partnerships. Make sure to work with the staff, and the chairs and the co-chair can help to bring them and share a first-hand perspective with this committee. I think that is an important area of flag. And then the last thing I would say is there will be areas of work which will be cross-cutting and will fit some other committees. So it'll be useful to work with the National Academy staff to make sure that areas such as sustainable financing for manufacturing, for example, or regulatory architecture, which are cutting across the 4 committees, are things that we at least have some semblance of coordination. You know, the wider audience who look at the outputs from this should be able to see at least some cohesive structure to that. Ensuring that is not always simple and easy, but I think Peter Sands has been a part of a similar exercise at the National Academies in the past, so would be able to guide you all better. Over, back to you, Peter.
Thanks, Prashant. And I think we have a few moments for any questions. I know you don't have a lot of time, Prashant, but one thing I think is important for people to be clear on is to be clear whether are we creating 4 different consensus studies with different reports that should complement each other, or are these 4 chapters of one report? Are the studies independent of each other, or are they sort of necessarily interlinked?
So I think the 4 studies are individual studies. They'll have individual reports. The International Committee would take some of these outputs into consideration and write something which may be International Committee's overall summary report. But I think for the purposes of these committees, they are individual and their outputs are individual outputs. But NASM staff can guide us better if there are more questions on this.
Yes, we can definitely talk about this as a group later as well. And thank you, Prashant. We are looking for 4 individual study reports. The International Committee will do some work with communications, dissemination, possibly a seminal article or paper, but we are doing an independent consensus study here.
I just thought it was worth making that clear, because it's therefore possible that one or more of the different fork studies will be discordant on some points. And I think that's not necessarily a bad thing. I think it's important that if we are discordant, we know why. And it's not just an accident, but we've actually flushed out what the underlying issue is that there are different perspectives on. If there are
Peter, you've gone on mute.
Oh, sorry, I put myself on mute. If there are other questions for Prashant, you can jump in, or you can highlight, you raise a hand, or you can highlight in the chat that you want to make a comment.
This is Bob speaking. Could I ask you, Prashant, for your perspective of including in our discussions, I haven't heard it so far today, elements of, let's say, the One Health world, and therefore, let's say, the veterinary world, and all the aspects that are taking place within that, not human health, but the animal health world.
That's a good question, Ox. I think when we talked in the international committee, we said this should be focused on the focus, and the scope boundary should include animal and veterinary vaccines and take a full One Health approach. But I think in drafting the statement of tasks, each of the committees took an approach of saying what is feasible in a short and compressed timeline. So as this committee revisits the statements of task, I think it's worth asking, to what extent do you want to get into areas which are about coordination on One Health? Where do you draw the scope boundary for this committee's output? And I think, again, we look for your guidance as well, Arkan, in terms of, where do you think, given the short and compressed timeline, should we draw the boundaries for this?
All right, thank you very much, President.
Conscious of time and your constraints, Prashant, if there are no immediate other questions, we'll obviously have opportunities to interact with the International Committee. And as I say, three of us, actually, if you include Richard, are members of the International Committee. So it's not going to be, this is not our only opportunity. If there are no other immediate questions, what I would suggest is if we say thank you, Prashant, thank you, and we can release you. And we turn to Colin from HHS. Thank you so much, Colin, for joining us and for giving your perspective as sponsor of this study, and indeed the whole exercise spanning the other studies as well. So over to you, Colin.
Thank you, Peter. And my name is Colin Weinberger. I'm a senior advisor in the HHS Office of Global Affairs, Office of Pandemics and Emerging Threats. And I lead our influenza and pandemic preparedness team. I wanted to start off just by thanking all of you, the committee members, for coming together and volunteering and dedicating your time to this initiative. We know that you are all, have day jobs and are very overcommitted and very involved in the response, the global response. And so we deeply, deeply appreciate your participation and lending of your expertise to this study. As you all are very well aware, the COVID-19 pandemic has been one of the most disruptive and costly in terms of both lives and economic losses of the last century. We've got over 2.5 million deaths globally. There's been an estimated $3.7 trillion lost in global GDP. And the broad consequences of this pandemic will surely be felt for many years and decades to come. The global response has mobilized and stimulated among a collaboration among international science community, international organizations, and governments in ways that have never been before seen. And the innovative technologies, platforms, tools, and collaboration mechanisms that have been developed during this response, as well as the important lessons learned, should be thoroughly documented, analyzed, and harnessed to help the world respond better to pandemics in the future. Even amidst COVID-19, we also know that influenza remains an ever-present threat and the pathogen most likely to cause the next pandemic, which we also know could happen at any time. Even amidst, the international community, we feel has a responsibility to use the COVID-19 pandemic to inform and improve pandemic preparedness broadly and influenza preparedness specifically. The 4 specific topic areas in this National Academies initiative, research and development, supply chains, non-pharmaceutical interventions, other public health interventions, and global coordination of partnerships and sustainable financing touch on multiple angles of the pandemic and giving us successes and lessons to learn from. Although we recognize that we're still in the midst of this response and lessons are going to be continuing to evolve even throughout this study, we know that we can't afford to wait until the end of this pandemic to identify ways we can use what we're learning to improve pandemic preparedness for the next influenza or respiratory disease pandemic. And that's where you all come in. We are thrilled that the National Academies have been able to rapidly convene such an esteemed committee of experts to reach consensus recommendations on these critically important questions. And we really look forward to the outcomes from this committee to inform both US preparedness efforts and also the global preparedness efforts. Speaking personally for a second, of the 4 consensus studies that are a part of this initiative, this committee's charge, and I echo Prashant here, this committee's charge is of, I think, particular and acute importance. To be totally transparent, this initiative was born as a consequence of the very unfortunate decision by the previous administration for the United States to withdraw from WHO and step back from several of the global partnerships that have emerged to combat COVID-19. This decision forced OGA to reprogram funding that was slated to support work with WHO's Influenza Preparedness and Response Team. This funding is mandated by statute specifically to be dedicated to improving global influenza preparedness. And we wanted to make sure that if we had to reprogram it, it would be used in a way that would make an impact at the global level and advance some of the aims aligned with what our long-term work with WHO have been. As I said, we're extremely thankful for the National Academies, Victor Zhao, Morgan Kinnarik, Judy Pavlin, Janelle, Pat Cuff, Emily, and the many others who've helped pull this together, this initiative together. And thankfully, as the US government, we've shifted once again to being fully committed to and engaged with WHO, as well as key partnerships like the ACT Accelerator and COVAX. We know that pandemics, by definition, don't respect any borders, and we've seen how critical these international partnerships have been to the progress we've made thus far in the global response. We also know that these will become even more essential through the coming months as the world mounts what will surely end up being the largest public health mobilization in history to roll out global COVID-19 vaccinations around the world. These public-private partnerships, including the ACT Accelerator, have been essential catalysts that have enabled research and development, manufacturing, scale-up, deployment, and delivery of COVID-19 diagnostics, therapeutics, and vaccines at a pace never before seen. And as I said, COVAX will be fundamental to enabling equitable access to COVID vaccines and protecting many of the world's most vulnerable populations. Many of these innovations and technologies have also harnessed funding from governments, philanthropic organizations, and private sector in new ways, getting technical support and collaboration from these sources as well, and working and putting forth actions in parallel and at risk that usually happen sequentially. Innovative financing mechanisms are going to be essential to enable successful vaccination campaigns around the world, and also essential to ensuring that we better prepare for the next pandemic. So with that, I just want to say thank you all again for taking the time to be a part of this committee and this initiative. We are confident the recommendations provided by this really all-star group of experts will help shape how the world prepares for and responds to future pandemics and influenza pandemics and pandemics of other respiratory diseases for the years to come. So thank you, and happy to take any questions.
Colin, I think that was extremely helpful, both in sort of giving an overview of the way you and the team at HHS are looking at this, and also a bit of the context as to how this whole exercise arose beginning in the last administration. I'd now like to ask members of the committee for any questions. Debbie, I know you wrote something in the chat. Did you want to expand on that in any way?
Well, thank you, Colin. That's really helpful outline of where we are. I guess my two questions would be, first, what do you see for the year ahead? And then what do you see for the next 2 to 3 years? So I guess the short term, the medium term, and the long term in terms of US engagement globally.
Thanks for the question. Yeah, I think that right now we're very much as a U.S. government still in a transition. We have, as I mentioned, fully re-engaged with WHO. I mean, we even throughout last year, we never fully disengaged. We were always continuing to collaborate on a technical level, but there was, it was awkward. So now we are fully engaging. I think over the coming months, globally, we're going to see a shift and a massive mobilization to vaccinate the world and to seek opportunities to ensure equitable access to vaccines, and to try and as we get further out, identify mechanisms to better prepare for next time. I think that we are well aware that, and we've moved away sort of from talking about ending the pandemic, because it unfortunately seems like COVID is going to be with us for quite some time. And it's going to be beyond this year that we're still scaling up vaccinations to the world populations. We know that. So I think in the immediate term, the response is very much going to be top of mind. I think that we will also be moving towards transitioning from an emergency response to a sustained disease control strategy around the world, and that's going to have impacts both for COVID as well as for other diseases, and particularly influenza, because we know that many of the experts who are leading COVID response around the world are influenza experts. And so I think there's going to be, it's going to be a period, definitely a period of mobilization and transition to sort of adapt to the new normal.
Thanks, Colin. And again, with committee members, if you want to either put in the chat a question or that you just simply want to alert me to the fact, or raise your hand. Keiji, old-fashioned raising of hand.
Well, it's about all I can figure out on computers. But Colin, thanks for giving the background information. Typically, when the U.S. government addresses an issue like this, part of the attention will be on the domestic implications, and the positives could be, again, really rebuilding the U.S. public health system, which has been eroded in many different ways. And part of the attention will go internationally. And can you give us a sense of whether the product, regardless of what it is being seen to drive or affect both of those agendas, or whether it is being seen more as an international agenda? Can you just give us a kind of sense of the context of its genesis and its potential consequences?
Yeah, absolutely. And I mean, we very much hope that this will drive both domestic agendas as well as international agendas. When we were coming up with the statements of task for these 4 studies and of the overall initiative broadly, we reached out across colleagues within HHS and across USG to get input. As you may be aware, in September 2019, the president signed a executive order to modernize influenza vaccine production, manufacturing, and development. And so we very much hope that some of the recommendations that come out of these committees around research and development could inform that process, could also inform how the United States is thinking about its global health leadership, in the years to come and coming out of COVID. But we also very much hope that this is not just a US-centric initiative. We wanted to be able to have these committees distill down some of the lessons that we're learning globally to inform how the international community is talking about and is adapting to the response as it shifts into new phases, and also how the international community can best take the lessons of COVID and use them to do better next time.
Thanks.
Bruce?
Thanks. Colin, nice to see you. Thanks for doing this and for supporting all of this. I'm not sure who this is to, but I guess the question, this may be to the Academy, or maybe to the sponsor, or to the International Committee. It seems to me there are going to be several places where similar topics are going to be relevant to several of the committees. I'll give you one example. There was an effort 10 years ago by WHO, supported by BARDA and I think Canada, to stimulate local influenza vaccine manufacturing. So that has a piece of R&D, it has a piece of supply chain, and it has a piece of this. So I guess the question is, how do we take an issue like that on? I'm sure there'll be several others most effectively, because that's a case study, if you will, that I think is going to have relevance to several of these different committees.
Janelle, should I take a stab at it, or
Please take a stab first, Colin, and then I can follow up.
So I mean, I think we recognize it, and you're absolutely right, Bruce, that there's a lot of topics that sort of span across these studies, and we recognize that the whole cosmos of this was far too big for any one committee to take on, and so I don't want to sort of prime the committees in any way on how you deliberate. But we're hoping that since the 4 committees are working in progress, we know that the NIS staff team are working very closely across the studies, that the studies would sort of be able to work out how to kind of bridge the topics that sort of span studies, like reviewing the global action plan for influenza vaccines, and talk about them sort of from each of the lenses that the committees are approaching these questions from.
And just to jump in there really quickly, and I don't want to take up much time here because this is the sponsors' time, but you're bringing up a very good point, Bruce. We do have our 3rd day of this meeting when we talk a lot more about the statement of task and our work plan. That'll be very important for me to be understanding the examples that you are initially thinking you'd like to tackle as a committee. And then we have weekly meetings between all of the project officers on the 4 different work streams or consensus studies. And so that will be important for us to understand kind of where we might early on have overlapping statements of tasks so we can guide you accordingly. So we're very cognizant of that fact, as is the wider international committee. And we'll kind of try to balance, the need for independent studies with making sure we have awareness of what everyone else is doing.
Colin, can I ask you a question? It's Peter. There's a lot of different sort of strands of international effort at the moment, whether it's through the G20 and the high-level panel that Amanda, for example, is involved in, or the G7, where the UK presidency is putting a lot of emphasis on pandemic preparedness. How are you thinking about the sequencing? I mean, is there a risk that we turn up and the international community has already decided what the answer is? Or I suspect it's going to be more complicated than that. Anyway, it'll take more time than, in a sense, people think. Everybody wants to get the answer quickly. But I could just see it's going to be quite difficult to juggle the different inputs and things to and get that sequencing right.
Yeah, I mean, I think that, I don't know if I have a great answer to that. You're absolutely right there. There's many groups now working to particularly think about the piece of how to better prepare for future pandemics. At the G7, at the G20, the Global Preparedness Monitoring Board, the IHR Review Committee, WHO Review Committee. There are many of these, many initiatives now working on this. And I don't think anybody quite knows yet, everybody's still trying to kind of figure out how all of these are going to ultimately relate to each other and work, hopefully not completely duplicatively. I think, what we are hoping this committee can do is really take a look at some of the lessons and some of the data from an independent perspective, and hopefully take in, some of these initiatives, like G7 is probably going to be mostly wrapped up before the committee is and the report is sort of fully baked. So we hope that as the outcomes of these processes are reached, they can be sort of incorporated in real time. But we certainly recognize that we've given you all a real challenge in terms of trying to make sense of something that's still very much ongoing.
I think Ark wants to jump in.
Yeah, thank you, Peter and Colin. This is a very interesting kind of discussion that we're having at the moment. And in my mind, it begs a little bit the question, in view of the fact that you said the kind of recommendations that may come out of our discussions are relevant for the US, but then you explicitly said that you hope it will also have a global function. So the first thought that occurred to me is, and this is maybe also to us as a committee and the national academies, do we have any plans to look at or interact with other national or royal academies that may have, if you like, maybe exactly the same committee as we are having? Let's say the Royal Swedish Academy, or my original country, the Royal Academy of Sciences and Arts in the Netherlands, or maybe with German Max Planck Institutes, and then expanding that a bit beyond the traditional geopolitical powers of G7 and even G20. Would it be desirable or not, or what would be potentially political implications to look at what kind of committees or recommendations are being underway with the Chinese national academies? Let me stop there.
That might be a lot for Colin. I mean, feel free to take that on if you'd like, Colin, but I can also comment.
Sure, go ahead, and then I can add anything.
And again, you know, Julie, if there's anything I'm unaware of, please jump in. We do not have plans at this point, especially for a fast track study like this, to be working with other academies. We do have plans to invite speakers from a more diverse geographical representation. If anybody has any suggestions as we're going through for other groups that might be tackling similar issues in a non-confidential way, I'm sure we would be eager to, you know, invite a speaker or representative from them. And I see Julie's screen is up, so please, Julie.
No, I was just going to echo that as well. We don't have any specific plans working with other academies, but absolutely we can bring those perspectives in as needed.
Yeah, and just from my perspective, and to sort of address some of the second half of your question, you know, we have encouraged the academies to reach out to whoever the committees feel would be informative for this study. I mean, we recognize and value selected the national academies for this because of their independence, and so you know we are leaving that up to the committee to take your data gathering where it may go.
Brilliant. I think we're just at time. I don't know, Janelle, whether Sylvie Billon has joined us yet.
She has not yet. She just sent me her PowerPoint, so I know she's online. She should be here any minute. Oh wait, she is right now. I'm admitting her right now. Okay, well, if Sylvie is coming on, I'm conscious that we are at time with you, Colin, and I don't want to abuse your diary, particularly as I know, as you said earlier in your comments, there's a lot going on within the new administration at the moment as you engage with all these different things going on and re-engage with WHO Act Accelerator and so on. I just want to close by thanking you first for joining us this morning and giving your perspective in such a really helpful way, and also for your support for this overall exercise.